Hi there, my name is Talon. I'm a student at Patty Hanks School of Nursing. This is for skills class. This is going to be the fish hook removal. So I'm just going to kind of jot over my soap note and then we'll do the procedure. So this is the patient. He is Mr. John Doe. He is a 40-year-old male. He came to the clinic today with complaints of a fish hook lodged in the dorsum of the hand. So the patient states he is experiencing pain and tenderness. He states he has no difficulty moving the hand or the fingers, but experiences pain when flexing the hand backwards. There is no history of allergic reactions, he's also never had a previous fish hook injury. His last tetanus shot was recorded as 2022. So, since our patient is uncomfortable and has a fish hook stuck in his hand, I'm going to go ahead and prepare to get this fish hook out. So a couple things I'm going to do beforehand. We've already verified allergies. His vital signs have been taken and they are stable. He does have a little bit of localized swelling and redness around the fish hook. That's going to be something that we're going to expect during this. And I can see everything I really need to see of the fish hook. There's not any missing parts or pieces. And as of right now, there's no signs of infections at this time. The patient's also not running a fever. So what I'm going to do before I start is actually obtain consent on this patient that he allows me to remove the fish hooks and let him know what the risks and benefits of the procedure are. And then next, what I'm going to do is I'm going to sterilize the wound. So at this time, I would be wearing gloves. I forgot to grab some from the clinic, so just imagine that I'm wearing gloves. And I would have someone helping me in this procedure most likely. And I'd have them hand me either a sterile gauze or a cotton swab dipped in povidone iodine. So at this point, I'm going to go ahead and sterilize the wound. So we'll say that this is dipped in povidone iodine. And I'd go ahead and just sterilize all around it, sterilize the fish hook itself without lodging it in any further, making sure that I kind of squeeze that iodine over into that wound. Perfect. So at this time, I'm going to go ahead and inject my lidocaine. I've chosen to use 1% lidocaine. At this procedure, 2 mL should be plenty to localize this area and make this procedure more comfortable for the patient. Main thing is I don't want to swell the tissue even more, so I want to kind of use a little bit lower of an amount. So I have a 23 gauge needle here, so nice small needle, and I'm going to inject this just right under the barb itself, about a 30-degree angle. This has already been cleaned, so everything that we're doing right here is perfectly fine. Go ahead and inject. Kind of chat with the patient, let him know that this is going to be a little bit of stinging pain that he may feel, but this should numb up pretty quick. So honestly, I put about 1 ml in there, and that seems to be significant. So I'd go ahead and take a sterile gauze and just kind of clean up that space, making sure it's nice and dry. So at this time, I'm going to wait about 5 minutes because I want to make sure that that lidocaine is going to work correctly. But I am going to drape some sterile towels around this area, just to make sure we're staying as clean as possible while we're here. So I've got sterile drapes around my area. My fish hook is visible there. Alrighty, so it's been 5 minutes, so I'm gonna go ahead and start working on getting this fish hook out. What I'm gonna use is the retrograde technique. So I'm gonna need some sterile, either tweezers, forceps, whatever you feel more comfortable with. And then what I'm gonna do is I'm gonna put a downward force here on the fish hook. I'm going to grab the fish hook. I'm going to grab the fish hook here at the end, and we're going to pull at a 45-degree angle, and the fish hook came right out. So what that allows is that downward angle allows that barb to re-engage in its original track, so that way when you pull at that 45-degree angle, you would be good. At this time, I'm going to go ahead and view the fish hook and just make sure that all parts of the fish hook are intact. I see the end of the hook and the barb, so I'm not too concerned about there being anything in the wound. But what I am going to do next is I am going to go ahead and remove these towels, push them back a little bit, and I'm really going to view that wound and make sure that I don't see any objects still in the skin, especially anything that had to do with the hook itself. So what I'm going to do next is I'm going to go ahead and clean the wound. So we need to use sterile normal saline, and we're going to go ahead and flush that wound out. So just a little bit of pressure, flushing that wound out. Again, sterile gauze, kind of soak up all the excess. Alrighty. And now that I feel good that there's nothing left in the wound and that it's been flushed with sterile saline, I'm going to apply some antibiotic ointment to it. So I'm going to get just a little bit of sterile antibiotic ointment. And of course with clean hands. You can also do this with a Q-tip. Just go ahead and place that right over, making sure that it covers the hole. I want to make sure that he's not bleeding profusely or anything like that. If he were to be bleeding more than we would like, at this time I'd go ahead and hold pressure with some sterile gauze over that hole. But this was pretty simple. It didn't nick anything on the way out, so we're going to get that antibiotic on there. And then lastly, it's going to be appropriate to put a Band-Aid over this. So we'll go ahead and apply a fun sterile Band-Aid right over that hole. Okay, so at this time, it's just going to be what is left on my follow-up. So I'm going to instruct the patient to monitor for signs of infections. This is increased redness, warmth at discharge. If any of those signs develop, he needs to call the clinic. If he's in an okay amount of pain, I would go ahead and be comfortable with doing 800 milligram ibuprofen BID for 3 days just to help with the swelling of this area. Really, he shouldn't experience too many issues, especially because we didn't have much of an issue getting the fish hook out. So also I want him to know that if his pain worsens or if he has any signs of infection or just anything at all concerning, that he needs to call me. And then I'm going to go ahead and provide the patient with a written post-op care instructions that includes just wound care and signs of infection to watch for. So last thing I kind of want to touch on is just that the patient has had a tetanus shot in the last 10 years. Last tetanus shot was in 2022, so there's no need to administer a tetanus shot to this patient today. Definitely give him an option to ask any questions that he may have. Tell him to keep the Band-Aid on for at least 24 hours. Try not to get it wet. After that, he can remove and just keep an eye on it. So thank you so much.